Hi and welcome to UroChannel. Testicular pain is a very common problem, especially in young to middle-aged men. It is a worrying condition to the affected, and many times they are told by their doctors that nothing can be found. After the fourth consultation at the latest, they get that psycho label, because if nothing can be found, the problem must be psychosomatic. Now, don't get me wrong. During the years of my residency, I also worked in psychiatry for several months, so I believe in psychosomatic disorders. To make one thing very clear, pain is always real. It's never imaginary. However, before banning the pain into psycholand, it might be worth to have a look at one area representing a white spot on the map that hardly anybody pays attention to. My name is Stefan Buntrock. I'm a urologist and sexologist. There are numerous reasons for testicular pain. Now you might be asking which they are. Here is a short sum up. If you're interested, I will put that list for you to read into the description below. So the first thing is to rule out any obvious cause, including a thorough history. A short while ago, a man in his 40s came into my office with testicular pain. I somehow got the impression that it might be muscular in origin. Finally, I found out that he had started gymnastic online classes during the COVID pandemic and was trying hard to accomplish splits. So that made everything appear in a different light. If nothing can be found, I think it is wise to go for an MRI to make sure nothing has been overlooked, like a small hernia that couldn't be detected otherwise. Okay, what is left? What is the secret ingredient? It is the pelvic floor. The pelvic floor is an incredibly complicated muscular structure consisting of several layers connecting the upper and the lower body. It connects to breathing as well as hip flexion. It is involved in defecation, urination, and sexual function. It stabilizes the body. So many functions that makes it vulnerable to disturbances. Pelvic floor dysfunction, including pelvic floor overactivity, is therefore a very common problem, yet nobody really talks about it. Pelvic floor overactivity means unnecessary or unintentional muscle tension in the pelvic floor. The reasons include unconscious contraction due to distress or anxiety, physical injury, faulty posture and postural abnormalities, repetitive activities or skeletal asymmetries. The permanently elevated muscle tone may cause something that is called referred pain. This means that the area of origin and where the pain is felt are not identical. Pain may be referred to the testicles, but also to other locations. Another typical location would be the tip of the penis. Many cases of so-called chronic abacterial prostatitis are muscular tension problems in reality. Why do I think so? Because very often the pain disappears in these patients when treated with shock waves. If you're interested what shock waves are, here's a playlist on ESWT. So when I get this question about testicular pain in my office, I start to look for other signs and symptoms of pelvic floor overactivity. These are lower back pain, a history of hemorrhoids, pressure in the perineal region, post-micturition dribble, weak urinary stream, residual urine, urinary urgency, reduced rigidity with erections, a burning pain at or after ejaculation, daytime variations in pain, and posture-related pain. Very often, several of these problems coexist. In my experience, physiotherapists are much better at the pelvic floor than urologists. Yes, we urologists know about the pelvic floor, but it doesn't belong to the core curriculum of our surgically oriented specialty. Therefore, it is easily overlooked. I have made it a habit to look for typical trigger points when I examine a patient. Trigger points are tender spots in the musculature that hurt when pressure is applied. They can be found in typical locations in the abdomen and also in the pelvic floor. I assess sphincter tone with digital rectal examination and take notes. How do I know all that stuff? Because of the workload, last but not least, obviously related to the COVID pandemic, with lots of patients suffering from pelvic floor issues. I guess I was lucky to start with shockwaves in these patients and got some unbelievable results right from the beginning. Lucky because it turned out not to work in all patients. So had I started with non-responders, I might have abandoned it. For the time being, my treatment plan is multimodal. I refer my patients to a physiotherapist who is specialized in the pelvic floor, and I offer ESWT. Thinking long term, it might be a good thing to implement yoga, as it resets and maintains good posture, which is the foundation of pain-free movement. Don't forget to subscribe. Thanks for watching. Bye bye.